Okay, see? So, nabuhayan tayo na. Okay, nadagdagan ng energy na maminaw sa phone speaker. Okay, that was truly a mesmerizing performance from the faculty of JRMSU. A round of applause again. Okay, mga students, di magpalubig later. But there are still many intermission numbers to be given sa ato nga mga faculty, dilisad sa palupig mga faculty. Mga talented ng students, of course, labaw na ang faculty. Okay, at this time, as we eagerly await the insights of our resource speaker, it is my pleasure and the honor to call in one of our beautiful instructors or colleagues who will be introducing our resource speaker for today's activity. Please welcome Miss Maybeth C. Nalzero.
Thank you, ma'am. To our campus administrator, Dr. Chana Sarafranca, to the Associate Dean of the College of Education, Dr. Sergio Tagaliran, to the Associate Dean of the College of Industrial Technology, Dr. Espiritu Sarita, to our campus nurse, Ma'am Emma Tan, esteemed guests, students, and honored colleagues, good morning. It is a great pleasure and a sense of privilege that I stand before you today to introduce our distinguished resource speaker, a luminary in the field of medicine, and a beacon of knowledge and expertise. As we gather here to commemorate this event, we are fortunate to have with us a distinguished professional who has dedicated her life to advancing the frontiers of medical knowledge and enhancing the well-being of individuals in our community. Our esteemed guest is a medical specialist with an impressive track record of academic and professional achievements. She is a graduate of Bachelor of Science in Biology at Ateneo de Zamboanga University, cum laude. A graduate of Doctor of Medicine at Ateneo de Zamboanga University, School of Medicine in the year 2010. A graduate of Masters of Public Health at Ateneo de Zamboanga University, School of Medicine in the year 2011. She is a municipal health officer for 11 years and 4 months, and an OIC chief to Hospital of Shokan District Hospital, and also the STI HIV/AIDS coordinator for 7 years. Her commitment to continuous learning and professional development is evident in the numerous accolades and certifications she has earned over the years. Beyond her professional accomplishments, our speaker is known for her exceptional ability to communicate complex medical concepts in a clear and accessible manner. Today, we have the privilege of tapping into her wealth of knowledge and experience as she shares insights in the World AIDS Day with the theme, Let the Communities Lead. Without further ado, please join me in extending a warm welcome to a true leader in the field of medicine, a compassionate healer, and an inspiration to all of us, Dr. Mary Therese R. Acevedo. Thank you.
Thank you for the introduction. Please sit down. Good morning. Dr. Chona F. Torrefranca, your campus administrator, to the OIC, Dr. Tagaliran, to the different teachers, to the different participants, blessed morning everyone. Okay pa po ba tayo? Gising pa po ba tayo? Sabi nila, pag mga itong maagang araw, yung mind natin medyo willing pa to listen. Pero along the way, medyo meron akong 84 slides. Pero i-concise ko lang po yan siya. I hope, kung medyo inaantok na, kasi nga yung brain cells now natin, will only last 3 to 5 minutes para makinig. The rest of that is just pretending to listen. So, if you do pretend to listen, no, take a deep breath so that while you're listening, meron kayong makuhang leksyon galing sa akin. Pwede po ba yun? Okay. So, ang task ko today is to give you to talk about AIDS. Pero hindi pwedeng pag-usapan ng AIDS kung hindi natin pinag-uusapan ng STI and HIV because it is a progression of a disease. Okay? So, bakit ba December 1? No? Ang December 1 is already known as the World AIDS Day. No? Na-start yan siya noong 1988 because at that time, binibigyan sila ng platform to express the program and also to honor those who died because of the epidemic. So ngayon, ang theme natin is, let the communities lead. Because marami na success na nagawa or may progress na ang program about AIDS. No? There are a lot of scientific studies, there are advancements, treatment, no? People living with HIV are enjoying their quality of life because there is a treatment, not a cure, but a treatment. Okay? So this day will be a reminder for us for those successes and also a reminder for us to be an educator to others, to spread the word until such day that there will be ang AIDS will be eradicated as a public health threat. Meron siya, nag-exist siya, but it will no longer be considered as a public health threat. So yun yung goal natin. Okay? Meron po bang nakukuha sa akin? Okay. So what is the objective, To define STI, HIV, AIDS, to give you basic facts about STI, HIV, AIDS, to provide the statistics of HIV, AIDS in the Philippines as of 2023, to give you risk factors for STI, HIV, AIDS, ano yung testing, background about treatment, and prevention of STI, HIV, and AIDS. Marami bang marupok sa lab dito? Marami bang naapektuhan sa breakup ni Katniel dito? O diba? Pag-iusapan ni Katniel, gising na gising kayo. No? Trending talaga siya ngayon. No? Sabog na sabog ang social media ninyo. No? So, pag-uusapan natin ang buhay ng isang faithful lover at saka yung maraming partner, Sakop yan sa pag-uusapan natin. So what is STI? Dati tinatawag siyang STD, But now it is being called STI. So it is an infection that is transmitted through sexual activity, pwede vaginal, oral, anal, sex. Bakit sa tinawag infection? We refer it as an infection because majority of those na mayroong sakit na ito ay walang simptomas. But it can be treated. They require treatment. If they will not be treated, then that will progress into a disease. Okay? So ngayon, ginagamit natin STI. Okay? So paano nga makukuha ang STI? Vaginal sex, anal sex, oral sex, skin-to-skin contact. Ibig sabihin, kung meron kayong mga samad, pwede yun. From a infected mother to a child during pregnancy, during childbirth, during breastfeeding. Okay? So why is it important that we talk about STI? It's because oftentimes wala kayong mararamdaman. You have no signs, you have no symptoms. So feeling nyo, I am safe. You are unaware na infected kayo. But because you are unaware, you will not receive treatment. And because you are unaware, magpo-progress into a long-term damage yun siya. And also, dahil hindi kayo aware, kung hindi kayo faithful, gusto nyo namang maraming putahe, then you can pass on the infection to others. Okay? So more than 50% of people will have an STI at some point in their lifetime. Sana hindi hindi kayo kasama sa 50% na iyon. Okay? So, curable ba siya? Yes, curable. Pag bacterial STI, it can be cured with antibiotic, but it cannot reverse long-term damage. So, ano yung mga bacterial natin? Chlamydia, gonorrhea, syphilis, trichomoniasis. While the other one, it can be treated, but it cannot be cured. Okay? These are viral STIs. You have your HIV, herpes, HPV, and your hepatitis. Okay? There are 3 types of STI: bacterial, parasitic, and viral. So, lahat ng mga bacterial, they can be treated with antibiotics. Pero, gonorrhea is a challenging one because meron na siyang resistance to penicillin and other medication. Kasi inaabuso natin yung gamot. Umamin kayo, yung iba dyan, bumibili ng amoxicillin ng walang reseta. May ulang amoxicillin. Merong sakit ng mag-ihi, amoxicillin. Kaya, ang nangyayari, naging resistant na ang bacteria. Kaya, nahihirapan na tayong mag-treat ng gonorrhea. Okay? Yung picture dyan, makikita ninyo, these are chlamydia infection. You have your herpes simplex infection. So, pwedeng ganyan yung presentation niya. What is chlamydia? This is the most common bacterial STI in the world. So, paano siya napapasa? Through unprotected oral, anal, with vaginal sex. So, paano siya mapoprotektahan? Use condom, no, for vaginal and anal sex. Use condom or dental gums for protection against oral sex. Mamaya, i-discuss natin paano gagamitin si condom, paano gagamitin si dental gum. Ayaw niyo magturo ako ng paano gamitin si condom. Pero yung iba dyan, nakikipag, mod-mod, diba? Tama ba? Nakikipag-mod-mod ka, ano yun? Usapang kali ang tawag dyan. Okay? So, chlamydia usually do not have symptoms. Okay? It can be cured with a single dose of antibiotic. But, kahit na-cure ka na, you can still get infected if your partner is untreated and untested. So, it can be cured, and you can get it as many times as you like kung hindi ka magpo-protect ng sarili mo. Okay? So, this is chlamydia. Paano siya, ano yung signs and symptoms niya? Dito na tayo sa picture. Pag lalaki ka, pag mag-ihi ka, medyo mainit, medyo parang mayroong burning sensation, masakit, makate, no? Pag lumalabas yung ihi mo, yung itlog natin, yung testicles natin, no? Legs sumakit, mag-swell. Salitang ano na lang para maintindihan, kasi baka magamit ako ng anatomical term, hindi nyo naman maintindihan, okay? So, mayroon siyang white, watery, or cloudy penile discharge. So, may lalabas para siyang kanang maputi, no, ng konti na madumi-dumi. No. Para sa babae, pag umiihi, medyo masakit, mainit, tapos meron siyang unusual vaginal discharge. Hindi yung discharge pag nagre-regla kayo na may puti na sticky lumalabas, hindi ganon. Okay? Bleeding, kahit hindi period or in between ng period ninyo, pwede kayong mag-bleeding. Pain dun sa abdomen or dito sa lower belly natin. Okay? Especially during intercourse. Gonorrhea is still a bacterial infection. Same way, paano mag-protect, paano napapasa. They do not have symptoms. The infection can be cured with antibiotics. Again, you have to get your partners tested and treated, and still, it is curable. So, anong signs and symptoms nito? Sa paglalaki, may discharge daw, white or yellow ang color. Same, pag nag-intercourse, medyo masakit. No, ay sa babae pala to. Bleeding in between periods, pain and burning sensation pag umiihi, pain at the lower abdomen or the pelvis. Okay? For lalaki naman, still white, yellow, or green discharge. No? Sa penis po natin, sumasakit yung dalawang balls, no? Pain and burning sensation pag umiihi, makate, no? Makate, palaging parang merong kumakate sa lalamunan natin, mahirap lumunok, no? Pwede din sa witan, kung male to male, no, anal sex na ginamit natin, kahit male to female, pwedeng itchiness, pwedeng discharge, pwedeng pain, pag nagde-defecate kayo or nagdudumi. So, gonorrhea can lead to, so kung gusto nyo magkaanak, umiwas tayo sa bawal. Sterility or infertility, painful sa dalawang balls natin. Sa babae, PID. Ang PID ay isang complication. Pwede siyang mag-cause ng long-term abdominal and pelvic pain. Pwede mag-cause ng problems sa fallopian tube. So kung gusto nyo mabuntis, huwag na tayong kumabot doon. Okay? Ectopic pregnancy or hindi kayo mabubuntis. Or pwede rin meron tayong disseminated infection manifested as rash, fever, arthritis, meningitis, and other signs and symptoms. Syphilis, same mode, same prevention, very rare bacterial infection. Again, it will cause a serious damage to the body pag hindi siya ma-cure, and it could include death. Ang syphilis is a wide range of disease, so therefore, nako-confuse siya sa other illnesses. So again, some will have no symptoms at all, can be cured with antibiotics. So curable pa rin siya. So, meron siyang stages. You have your primary, secondary syphilis that is caused by, yung tinatawag natin the great imitator. So yung primary syphilis, makikita mo yan siya as firm, round, painless, open, or wet wound, or parang ulcer. Anong ulcer sa Tagalog? Anong ulcer sa Bisaya? Ulcer. Samad ba? Oh, samad na malalim, no? So usually, nakikita siya sa exposed part. Pwede sa bibig, sa anus, sa lips, sa vagina natin, sa penis natin. And they usually appears 2 to 6 weeks after you get infected. But, pwede silang mawala ng walang treatment. But it doesn't mean na wala na siyang syphilis. You can progress into a tertiary or late syphilis. Okay? So, hindi siya safe. Secondary syphilis, after 4 weeks na mawala na yung ulcer, no, ang chamfer natin, they can develop into a secondary syphilis. In your secondary syphilis, even if mawala yung symptoms na, they can progress into the tertiary syphilis. So, ano yung presentation niya? Yung non-itchiness, hindi siya makate. No? Red, brownish spots, usually sa palm. Nakikita yan siya. Alopecia. So, kung medyo meron pagkakalpo-kalpo, mag-isip na. Halimbawa, sorry po, faithful naman siguro po kayo, no? So, lang pinapatamaan, sinasabi ko lang po, may nagirapi. So, alopecia or patchy hair loss, no? Mucus patches, kanang puti-puti, parang inuas na nasa inyong mouth, vagina, or anus. So, latent syphilis, this is a stage wherein walang symptoms. Parang feeling mo wala na kang syphilis. Okay na ako. And then it may take years. After 10 to 10 years, you may develop your tertiary or late syphilis. And this is the worst because it can affect your heart, the brain, the spinal cord, the eyes, and the bones, causing you mental illness, blindness, deafness, heart disease, death, and a soft vomit tumor called coma. So, meron siyang types. Cardiovascular syphilis, meron kang late benign syphilis, and neurosyphilis syphilis. Ang neurosyphilis affects your central nervous system. So, it may present na mahirapan kayong mag-move, may paralysis, may numbness, may blindness, may mental disorder, and can result to death. It can also progress as a part of the process of your HIV. Okay pa ba? Hindi ba kaya na-board? Okay. So, sa mga bata, yung hindi pa pinapanganak, it can cause congenital syphilis. So, 40% of those nagiging stillborn or stillbirth or namamatay sa hospital. This transmission can occur during any stage of the syphilis and during any first or trimester, first, second, third trimester of pregnancy. Ano yung cause? Prematurity, birth defect, Hashimoto's, osteoarthritis, developmental delays. What is the parasitic STI? So, ito yung sinasabing medyo mahugaw talaga, no? So, bakit? Puto. So, ang puto, hindi lang siya sa buhok. Pwede din doon sa baba dahil buhok din yun. So, ang tawag doon is pubic lice. Okay? Scabies, trichomoniasis. So, pubic lice. Nag-stay sila dun sa pubic hair and they feed on the human blood. So, kung paano mag-transfer si puto sa ulo, ganun din dun sa baba. So, pag mag-sex kayo, mahaba yung hair natin, maka-transfer siya. Okay? Scabies. Ito naman ay mga itch mite. Makate masyado. So, ginagawa niya, kung hindi niyo napapansin yan, magagawa siya ng hole doon sa panit, no? Tapos doon sila magsistay. They can stay outside the human body 2 to 4 hours. So, sa higaan ninyo, sa ginamit niyong towel, sa bathing suit ninyo, or mga damit ninyo na sinishare nyo, ay pwedeng magstay doon ng 2 to 4 hours and pwedeng mag-transfer siya, especially if may open wound yung other person. So, never share anything. No? Kahit boyfriend na, ayaw yung i-share eh. Diba? O boyfriend talaga, nag-react sila. Malakas sila sa love life, no? Trichomoniasis, no? They can stay outside, no? So, wet towels or anything wet, no? They can stay within 24 hours. So, ito, ang tawag dito ay guard cheese. Parang cheese, ito siya. Hindi tayo ng cheese, ano yung tawag sa cheese nila? Yung nilalagay sa carbonara, yung nag-melt sa taas. Parmesan cheese. O, parang ganun siya. Ganun yun pag lumalabas. Ganun ka-yellow, medyo mas sticky-sticky siya. So, how does it spread? Through vaginal sex. 70% of those infected will not have signs and symptoms. But if they do, they will have abnormal discharge, burning sensation pag sila laki nag-ejaculate or nag-urinate tayo. Meron siyang foul odor, cheese-like, curd-like na discharge po. And sa genitals, makate, mahapdi, mapula, at parang mainit. Okay? So how do you prevent parasitic STI? For trichomoniasis, condom. For pubic lice and scabies, avoid sharing towels, clothing that have not been washed. When trying on, kung nag-fit tayo ng mga bathing suits, underwear, please do so with something underneath. Kasi pwede din daw. No? Intense, ano yung mga signs and symptoms niya? Intense itchiness, redness rash, pain during sex or urination, vaginal discharge. Ano yung pwedeng i-treat? Pwedeng shampoo. No? Hindi lang sa buhok, pwede din tulo sa baba. Lotion, ointment, and antibiotic po. So what is PID? Na-discuss ko na ito. They can be mild or no symptoms or they present sa mga symptoms na sinabi ko kanina. Viral STI, HPV, HIV, herpes, hepatitis, AIDS are your viral STIs. So your genital herpes is caused by a herpes simplex virus. A herpes simplex virus 1 is the one that causes sore, oral, and cold sores. Yung nakikita sa bibig, yung parang mayroong mga luwas-luwas. Yan. While your HSV2 naman will cause your genital herpes. So, nakikita sa rectum, nakikita sa vagina, sa penis po yan. So again, same mode of transmission. They could be mild, they could have no symptoms, but this one is not, it cannot be cured, but the symptoms can be treated. Okay? And pwede siya magkaroon ng maraming luwas-luwas. So, kung akala niyo luwas lang yun, tapos i-check niyo yung lifestyle niyo, ay, pasok ako. Hindi ako faithful. Marami akong sex partners. Hindi ako nag-sex with protection. No? Meron akong mga contact na meron akong lesions, then therefore, pasok ako sa pwedeng yung blisters ko could be a cause of the genital herpes. Okay? Again, it's treatable, not curable. Inuulit ko kasi mamaya may tanong ako. HPV, mamaya mag-true or false tayo. So, dapat nakikinig kasi lalapit ako sa inyo. HPV. So, actually, ang Shokan very very privileged because as early as grade 4, merong binibigay ang Department of Health ng libreng HPV vaccine. Kung nagtatanong kayo, bakit hindi kami eligible para dyan doon? You can be eligible as long as you have a pap smear result that is normal. If you can bring that to me, then we can give you an HPV vaccine. But if not, hindi kayo magiging eligible unless you visit your private obstetrician and gynecology. Okay? So, ito, very contagious virus. Some people never get the symptom. Same mode of transmission. They may present as genital warts or other types that can cause cervical cancer. So it's very common. 80% of sexually active men and women can have at least one type of HPV strain at some point in their lives. Okay? Most people with HIV, they do not know they are infected and they never develop symptoms or health problems. It is not curable, but it can treat the health problems that is associated with the HPV, such as cervical cancer, genital warts, and other HPV-related cancer. So, ito yung lahat ng cancer na pwedeng makuha or maging high risk tayo sa HPV. HPV, so kung may warts ka, pwede siyang matangtang, pero ang virus will stay in the blood. Most warts, they will clear at one point, no? But again, this is not curable. Treatable lang ang signs and symptoms or other na pwedeng mag-risk factor sa iya. There's a vaccine available as early as grade 4. Okay? Hepatitis. This is known as the inflammation of the liver that is caused by the virus that affects primarily your liver. It causes liver disease and cancer of the liver. So, your Hepa B and Hepa A can be prevented with a vaccine, while your Hepa C cannot be prevented with a vaccine. This is not curable. You can only contain the viral load. So, how is it transmitted? Pag Hepa A, sinong mahilig kumain sa mga kalye-kalye? Sino? O magbantay. Because you can get Hepa A through contaminated food, drinks, no? Because it is transferred through fecal oral route. So, kung hindi malinis yung pinagbilhan ninyo, pwede meron siyang hepatitis A, no? Hepatitis B can be transmitted through blood and any body fluids. Hepatitis C transmitted primarily through blood and also bodily fluids. So, paano mo bababaan ang chance magkaroon ng Hepa B and Hepa C? 1. Get vaccinated. For kids, available ito. For students like midwifery, meron sila privilege to get vaccinated before they go on duty because they have higher risk of vulnerability to get infection from blood because they handle delivery. Okay? Practice safer sex. Do not share instrument like body piercing, tattooing, or hair removal. Sino nagpa-tattoo dito? Yung mga time na uso-uso pa yung tattoo dito. So make sure kung magpa-tattoo, you ask the tattoo artist kung sterilize ba yung gamit niya. Kahit yung magpa-pedicure, manicure, make sure you ask them, painitan muna yung gagamitin before gamitin ulit yung ginamit niya sa ibang gamit. Okay? Do not share personal items such as toothbrushes, razors, and needles. So yan. Ang pinaka-worst dito is your hepatitis C because 75 to 85% will develop chronic liver disease, 5 to 20% develop cirrhosis, and 1 to 5% will die because of a chronic liver disease. So now, tapos na ako sa STI. Magtatanong ako ngayon. True or false? Nasagot ko. Nasagot at nasabi ko ito. 1. You cannot get an STI from oral sex. True or false? Very good. Kasi nga, pwedeng vaginal, oral, anal, skin contact, and mother to child. 2. Birth control protects against pregnancy and STI. True or false? Sinong true? True. Sinong false? Okay. Anong tama sagot? False. Very good. Why? Sinabi ko kanina, only condom. Diba? Condom palagi yung sinasabi ko.
Condom.
No? Wala akong sinabing other birth control except condom. Okay? Number 3. Once you had an STI, you cannot get it again. True or false? False. Yes. You have to check. Yung partner mo, magpa-check, magpa-test, and magpa-treat. Number 4. Anal sex has a higher risk of spreading STI than other types of sexual activity. True or false?
False.
Ha?
False.
True. Sila false?
False.
Ang false is sir. No. True sila. So, ang tama sagot is true. Bakit? Explain natin. Kasi yung web natin, medyo manipis lang yung covering niya. So, contact penetration and force will cause it to magkaroon ng wound, which increases the risk of you being exposed to getting the infection. Okay? Number 5. Kaya huwag magpalubot. Okay? Tama ba?
Galing lang.
Joke lang po. Okay, kasi po, being trained as an HIV counselor, no? Wala po kami dapat na mga hesitations. You have to be frank, no? As much as possible. Kaya medyo hindi ako mahiya magsabi. Okay? You cannot get an STI if your partner is a virgin.
False.
Ha?
False.
True?
False.
Lakas? True?
False.
False. Ano man? Ano sagot?
False.
False! Masasabi mo ba na virgin siya kung hindi mo siya tinira? Di ba? Masasabi mo na siya virgin pag nag-penetrate ka. So, hindi ka magiging sure kung safe siya. Okay? Number 6, sabi niya, only promiscuous or trashy people get STI. Masalawahan lang daw ang pwede mag-STI. Tama ba? Very good. No judgmental siya. So, you cannot have STI at once. Dapat STI lang isa. Hindi ka pwede maramihan. Tama ba or mali?
Pwede
Ha?
siguro.
False. You can have 10 STIs at one time. Okay? Number 9. Women are more likely to get tested of STI. True or false? Ha? Ang babae daw ang mas malaking chance na mag-STI. Tama ba? Papayag ka mga babae? Ha? False. Sabi ng mga babae. O lalaki? Tama ba? True daw. Oh my God. Naman ang kalala ng mga lalaki at babae. Ang sagot ko, sorry sa mga babae, tama daw. Bakit? Because the anatomical and physiological changes sa mga babae makes it vulnerable to have higher risk. Okay? O, eto, judgmental din. Lesbians cannot get STIs.
False.
False. Kasi sinasabi nila male to male lang. Walang female to female. Any word of contact, pwede basta hindi protected ng sex. Okay? If my partner has an STI, malalaman ko ba, makikita ko ba na may STI siya?
No.
No, because they usually do not have signs and symptoms. Masaya ako, marami kayong natutunan.
Taga na correct yan.
Okay. Okay. Medyo mabilis-bilis na tayo. What is HIV? Human, because it is transferred from one infected human to the other. Immunodeficiency, because there is a weakened immune system. And virus, this is caused by a virus. Okay? So, it is a virus that is spread through body fluids and affects specific cells of the immune system, particularly your CD4 or your T cells. So a virus that kills the CD4 cells can damage your immune system, and this virus, they can get into a healthy cell because they need a healthy cell to reproduce and to transmit the infection. Okay? What is AIDS? AIDS is acquired, ibig sabihin nakukuha, hindi siya hereditary, through sexual contact or any body fluids na sasabihin ko mamaya. No, this is the late stage of your HIV. So, once diagnosed, it is difficult to fight and can cause certain cancers. There is no cure, but there is treatment for opportunistic infection. So, ano nga ang AIDS? Once you have your positive HIV test, plus a very low CD4 count, or any cancer or opportunistic infection is equivalent to acquired immunodeficiency syndrome. So, ano bang statistics? Dito sa Shogun, meron tayong 5. And when we do bloodletting, tinitest din po yan ng HIV. So when you receive a letter coming from me, it means there is something in your result. But you have the right whether to tell me the result or do not tell me the result. I cannot force you. Kayo ang may karapatan whether you will seek consultation or not. No? So kaya, donate blood. Kasi dyan pa lang, natitest na natin kung meron ba kayong HIV. Okay? There are 54 average cases per month. No? There are 2,078 new cases for the month of March only. Okay? Sino-sino or anong mode of transmission ang very common? Hello?
Hi!
Okay. Very common daw, male to male transmission, male to male transmission, female to female, male to female, sharing of infected needles, and mother to child. Anong edad? Medyo prominent siya. Sabi nila, 48% sa 25 to 34 years old. So, sinong pasok sa age group? Sinong nasa 25 to 34 dito? Oh, i-check na yung sarili. Gumawa na ng checklist. Faithful ba ako? Isa lang bang partner ko? No? Wala ba akong extra recipe? No? Nagpo-protect ba ako pag nagsisex ako? Ano pa? No? Those mga criteria. Tapos, 31%, 15 to 24. Sa clinic, I receive as early as 12 years old, meron na silang STI. Anong common cause? Binabayaran sila. No? Pang-load, pang-kain, pang-laag. So, if you will do that, please visit the RHU. May available condom for free. Kahit isang box pang inyo. Okay po. Kung nahihiyahan naman kayo, pumunta kayo after 5. Dahil wala nang tao. Kayo lang i-entertain namin. No? So, kung nahihiya kayo. Okay? What are the 3 ways to spread HIV? Unprotected sex with people living with HIV, blood-to-blood contact, exposure to HIV before or during birth, or through breastfeeding. Ito yung mga fluids. Alalahanin ko. Blood, rectal fluids, semen, duga, tama ba? Okay? Vaginal fluids, breast milk. These are the 5 fluids na dapat naaalala nyo kasi ito lang yung mode of transmission natin. So how? Paano kung papasok? Mouth, nose, eyes, anus, vagina, penis, open skin. Ano common denominator nila lahat? Butas. Oh, lahat ng may butas, pwede silang pumasok. Okay? So, they may not have symptoms at all for 10 years or more, so they will not know if they have HIV unless they get tested. So, symptoms may vary from person to person. Some may have flu-like symptoms within 24 weeks, 2 to 4 weeks. So, feeling nyo ay flu lang ito. Pero pagtingin pala sa mga risky behavior, pasok na pasok pala doon. So, magpa-check up na tayo. So, viral load and CD4 count, important ito kasi ito lang yung ginagamit natin to know if we do have infection. Your CD4 is the one that makes you strong to fight off your HIV. While your viral load is the amount of the HIV that is found in your blood. So, what is your window period? So, kung naka-receive kayo ng test, result na negative, should you be happy? You should be happy if wala kayong risk factors. But if you have risk factors, you should doubt. Why? Because there is a window period. There is a period wherein mababa or hindi pa ma-detect ang HIV antibody, pag tinitest yan, because it may take 9 days to 3 to 8 weeks before you'll be able to detect the HIV antibody. So, ang HIV antibody is the mode of defense of your body to fight off the virus. So, kung hindi siya ma-detect, you repeat that after 3 months. Okay? Because why? You are immediately infectious. Makatakot na ka. Okay? So, what does HIV test mean? Pag positive, there's an HIV antibody found. The virus can be transferred to other person. You need a treatment immediately. When it's negative, it may mean you do not have an antibody HIV, but you have to consider to take the test 3 months after if you have risky behaviors because you might consider window period. Okay? Opportunistic infection is one of those that will tell you probably have AIDS. Meron akong patient, na namatay na siya matagal na. He came in rush lang. Parang meron siyang kulang-kulang rush Makate. So, as per first look, medyo gay siya. Hindi siya nagde-divulge ng information na meron siyang promiscuous sa partner niya. So, very hesitant siya. So, he came in, Makate lang daw. Sobrang kate. Pero at the back of my mind, I was considering na, not because discriminating ako, but because it is a possibility. So, he was saying na nakuha niya lang a few weeks ago, and may kinain siya, kaya kumakate. So, we started on a treatment para dun sa rush niya. But then, I asked him, do you want to get tested? And at that time, he was very hesitant, ayaw niyang gawin. So, when I tried to ask other people if they knew someone like this, para makuha ko yung background niya. So, meron akong nakuha background. So, when he came back, I told him, if I start you on a steroid therapy, I might damage your organ. So, it's better if you tell me what you really need so I can treat you. But if you don't like, then wala akong magagawa. So, he didn't divulge the information. He went to Zamboanga. When he was there in Zamboanga, he was at the late stage now of the disease. Affected na lahat ng organ niya. He had a chronic kidney failure when he got there. So, pagpunta na doon, hindi siya nasalba. When he came back, yung death certificate na lang yung binigay sa akin. And sa death, he will not be diagnosed. So, don't worry. He will not be diagnosed with HIV or AIDS because that is a patient right. Hindi pwedeng ganun yung diagnosis. But there is certain term that is being used para malaman namin na it is an HIV. And true enough, HIV siya. So sa ating side, getting tested will relieve us. Dahil hindi siya dapat hindi nakakatakot. Dapat you should be doing that because it will protect you. Because if you wanted to live longer, then you do what is needed. Katulad niya, gusto niya mabuhay, pero very hesitant siya. Siguro nahihiya, may stigma, may discrimination. He's a teacher actually. So hindi siya nagpa-test. But eventually, it was the last na magawa namin for him. Okay? So the presence of STI increases increases the possibility of acquiring HIV and transmitting HIV because you have a compromised immune system. Marami kang pwedeng makuhang STI. You have irritation and inflammation sa mga mucous membranes ninyo na makes you susceptible for opportunistic infection. So, if you are newly diagnosed, start treatment immediately. Is it free? The DOH meron po yan silang binibigay na free treatment. No? So, pre-test din po yan. You're very lucky because meron tayong trained na personnel last week to do HIV testing. So, probably next year, you can avail an HIV testing sa amin sa RHU. Okay? Yes po, free. Because of better treatment, no person living with HIV can live longer and a better quality of life. Anong example? Si Michael Jordan. Jordan ba?
Si Juan.
Tama ba ba?
Dili
Michael
ma'am. Yung isa ma'am, si...
Jordan ba? Jackson?
Yung sa Lakers. Magic.
Michael Jackson.
Magic.
Sorry.
Magic Johnson ma'am.
Magic Johnson
Magic
pala.
Johnson.
Magic
Johnson.
na ako. MJ.
MJ.
Magic Johnson. He has an HIV. Isa na sa mga advocate natin. But he is living a better quality life because he continued to take his meds consistently and monitor his CD4, the viral load consistently. So, no treatment. Is there a cure? No cure. But there is a treatment to slow the progression of HIV to AIDS or other opportunistic infection and minimize malnutrition. So, the most effective treatment is your antiretroviral therapy using your antiretroviral drug. Pero, multiple pill ito. Hindi lang isa, maramihan. Which is a challenge, no? A challenge for you to continue medication because it is a multiple pill. Maraming uncomfortable side effects. Medyo expensive siya. And you'll have to take it for the rest of your life. So, ang Pilipinas, medyo poor. So, meron si DOH. No? Pero sa ibang lugar, hindi ganun kapilan. Okay? So again, it's expensive, complicated, toxic, and pag hindi tama yung pag-inom, you can have resistance and the treatment will be ineffective. So, undetectable is equals to untransmittable. So, dapat, you have to check regularly, stick to the treatment, consistently monitor para you can live, no? After 6 months of viral suppression, you can live a better life na mababa yung viral load, you can have sex without transmitting the virus. As long as you're protected. O last, true or false? Wala pa, grabe, excited. So ngayon, HIV positive daw ako. We are. Now my life is over. True or false? Very good. So, I can get HIV by being around of people who are HIV positive. True or false? Sila, ano nga yung body fluids? Body fluids? Blood, rectal fluids, semen, vaginal fluids, and breast milk. Okay, 3. I will not be able to tell if my partner or I were HIV positive. True or false? True. That will arise signs and symptoms. 4. I cannot get HIV from mosquitoes.
Blood.
No. No. Sino ang sabi false?
Blood.
Blood. So, nalito sila sa blood. Okay. Tama, blood. No? Pero ano po ba yung mode of transmission? Again, human immunodeficiency virus. From one human infected to another human infected, walang intermediate. Okay? So, hindi. Okay? Tama siya. 5. I am straight. Pag straight, babae ako, lalaki ako. No? And you don't inject drugs. So, I cannot get HIV. True or false? Hindi naman sinabi, I'm not sexually active. No, I abstain from sex. Wala namang ganon. 6. I can get HIV from oral sex.
True.
True. Okay? My partner and I
So there is no need for me to use condoms. True or false? Ha? Ano false?
Medyo,
Ano yun?
medyo yan.
True or false? False. False ba? Tama. Kasi nga, may iba-ibang strain ng HIV. So you still have to use condom. Okay, sige. Ano na yung mga risk factors? So, i-check yung sarili. Meron ba ako nito? 1. Multiple sexual partners. Sinong pumasa? Walang magnanakaw ang magsasabing magnanakaw ako. Diba?
Dalawa lang.
So, dalawa lang. Dalawa lang ito sabi ni Sir. Non-use of condom. Early sexual intercourse. So, kung mga teenager, very hot, gusto mong explore with protection. Okay? Unfaithful to one partner. Hindi na ako masasabing wag. Dahil the more na sinasabihan mong wag, ginagawa. So, gano'n, sumabay ka sa uso. Gawin mo kung gusto mo, hindi ka mapipigilan. Pero protektahan mo sarili mo. Gusto mo bigyan pa kita ng kondo. Gano'n, diba? Oh. Premarital sex. Kasi sex before marriage. Commercial sex worker. Meron yan dito sa Shokon. Marami yan. No, yung iba sa mga adults pupunta sa akin, mga one-timer lang. Sino po ba yung naka-sex ni Sir? Naglaman yun, 18 years old, bago pa daw, bata pa daw, nabentahan ka ng luma, Sir. Sorry, sayang ang pera mo, nagkasakit ka pa. Ganun. Kung ano to, fourteen practices. For other areas, meron na silang mga gang rape, no? Gang sex, ganyan, sa court nila. Harmful tradition practices, like sa Africa, yung inaalis nila, unsterilized yung part ng female, yung clitoris, no? Ano pa? Physiologic makeup. And last, others, which includes pag may alcohol, may balak. Pag may balak, may masamang mangyayari. Right? So those are risky health behaviors. So reducing the risk, dalawa lang yan. I don't want to have the risk. So anong gagawin mo? Abstain from sex. Ibig sabihin, magiging non, no? Madre, pare, walang sex. Abstinence from injection drugs. Mutual monogamy with STI negative partner. So how do you reduce the risk? You can go have sex, but you have to correctly and consistently use protected sex condoms. Okay? Fewer sexual partners. Medyo mabait pa siya. Fewer daw. Never share needles or words. Regular HIV, STI testing. O ito, condom na. Gusto niyo ba makinig? Okay. How to not use or incorrect use of your condom. Huwag gamitin na paulit-ulit. Once na po yan. Okay? Huwag kang titipin. Ha? Okay, go! Bumili ka. Hindi mo naman sinek ang expiration date. Hindi na buntis. Huwag ganun. And then, huwag yung unroll the condom before you put it on the penis. Huwag yung ilalabas na before mo ipasok siya. Dapat erected na siya. No? Ready to ejaculate. Ready to go na. Saka mo siya ipasok. Okay? We do not leave the condom. Kasagaran nilalagay sa mga U-box, sa sasakyan, no? Parang pag gumawang gera, meron ng sandata. Pero mainit na. E di sayang. Di pwede pa rin magbuntis. Pwede pa rin magbutas. Okay? Do not use oil-based. Huwag yung laway, no? Meron talaga siyang lubricant. Yun ang gagamitin natin. Do not use your fingers, your mouth, to rip it off. Baka masama si condom, manipis ka naman, napunit. Napuntis pa, guys. Okay? Use more than one condom at a time, no? Ulit, hindi recyclable. Single use lang.
Double wrapping.
Okay. Correct use. Keep condom in cool, dry place. Put condom on kung erect, hard na yung penis before sexual intercourse. Hold the condom in place. Di ba pag aalisin na? Hawakan sa dulo to remove it gently. No? Okay? Before withdrawing.
Throwing away, use lubricant na water-based or silicone only, hindi oil-based. Meron kang female condom? Yes, meron po. Available na sa DOH? Sorry, wala po. So, ikinocoveran niya yung buong vaginal area natin. The latex free, medyo manipis siya, no? You can wear it in your vagina or sa anus. Ito yung dental gums. Nilalagay ito sa bunganga. This is only used for oral sex, okay? Ginagamit ito ng mga sexual workers to protect themselves, okay? Pwede square pieces of latex that can, ilalagay niyo siya, parang wrapper lang siya, plastic wrapper na microwavable, no? Ilalagay siya sa bibig, okay? So how frequent do you get tested? Pag ang edad mo daw is 13 to 64 years old, at least get once a year test for your HIV. Pag naman, occasionally exposed na nga sa HIV risk, at least once a year pa rin. Pero, kung high risk ka, 3 to 6 months. Okay? Gamitin gonorrhea once a year, no? And it increases pag meron kang mga risk factors. For syphilis, sino dapat ang nagpapatest? Buntis, men who have sex with other men, those who have sex for drugs or money, merong HIV or another STI, have sex with someone who is tested with syphilis. So, yan ang magpapatest. So, malapit na. Matapos na ako. These are the A, B, C, D, E of how to prevent having STI, HIV, AIDS. 1. Abstain from sex. Kaya ba? Kaya po ba? Ha? Pwede naman daw sa willing sikap. No? Joke lang po. So, abstain from sex. 2. B. Be faithful to your partner. Huwag maging, sino na ngayon? Si Daniel Padilla. So, Katrin lang. Ano ka hahanapin mo? Liligong ka pa ba? Nandun ka na sa matino, ang hanap mo pa ng hindi. Huwag magbiglang liko. Straight path lang tayo. Kung ayaw mo, tumigil ka na lang. Ganun. C. Consistently, correctly use condoms. So, huwag kalimutan, lalaki, babae, before magkaba ng pantalon ng panty o brief, dapat may sandata. Kung hindi ka handa, panagutan, mabuntis, kung ayaw mong magsisi dahil magkakasakit ka, maglagay ka na lang ng condom. Unless, kung kinasal ka na. Pero kung ang pinakasalan mo, marami rin kasama, na hindi mo alam, good luck na lang sa'yo. Okay? Do not use illegal drugs slash. Do not drink alcohol. Okay? Pag may alak, may bala. At pag may bala, may masamang mangyayari. Okay? Last is E. Educate yourself. Dahil na-educate ko na kayo, dapat meron din kayong responsibility to educate others. Start with your loved ones. Okay? Last, to end, safe sex or no safe sex at all because your life is at stake. Isip-isip before you unsip. Before ilaban, ano nga tawag mo sa mga babaeng dalaga? Before ihatag, before isuko ang bataan, mag-isip muna tayo. So with that, have a blessed day everyone. Good morning.
Okay. Kaya pa ba? Hi!
Hello!
Hello! Okay. What week? Di ba? Ang ganda ng topic. Did you learn? Okay, yes. A big thank you, Dr. Mary Therese R. Acevedo, our Municipal Health Officer, our resource speaker, for gracing us with your presence and sharing your expertise and invaluable insights. We have had the privilege of hearing from a true expert in the field. As we delve into the program ahead, let us keep in mind the transformative power that communities hold when they stand together. Together, we can pave the way for a future free from the burden of HIV and AIDS. Let us honor the resilience of those affected and continue our collective efforts to ensure that no one is left behind. As a sign of our gesture of appreciation, I would like to call in our officer in charge, Dr. Sergio A. Sabiriran Jr., and of course, our school nurse to hand in the certificate of appreciation and token to our resource speaker. Let me read first the citation. I would like also to request, of course, our resource speaker to be here. Rizal Memorial State University Shokan Campus award this certificate of appreciation to Dr. Mary Therese R. Acevedo for sharing her valuable knowledge as a resource speaker during the conduct of symposium on World AIDS Day with the theme Let Communities Lead, held at JRMSU-SC Campus Covered Court on December 1st, 2023. Given this first day of December 2023 at JRMSU-SC Campus, Manaol, Shokan, Zamboanga del Norte. Signed, the OIC, Dr. Sergio A. Sabiriran Jr. Once again, thank you so much, our Dr. Mary Therese R. Acevedo. Our doors are always open and we look forward to welcoming you back in the future. Once again, a round of applause to our resource speaker. Okay. Okay, at this juncture, ladies and gentlemen, so as what I have said a while ago, we have heard already the golden voices from our students. At this time, didn't paawat yung instructor natin, of course. Our next performer, or to give an intermission number, he is, shall I say, talented, an award-winning personality, the pride of BSCS and BSIS, and of course, the pride of JRMSU Campus, since he is the one he is the representative